Karine with Karine and Company. This is my friend Olga. And today what we did was we did some ear therapy, but then afterwards what I taught her to do was to use a tennis ball at home, because even though she has the seeds in the ear and her pain level went from like an 8 to a 3 or 4, I wanted to teach her how to use this at home. And you use it, you can lay on your bed or on the floor, but I feel sometimes when you use this on the floor does not give, but the bed does. So I'm going to just have Olga turn around and I'm going to explain to you what I asked her to do on the bed. So what we did was we put the tennis ball, here's the blade of her scapula on both sides, and then the spine runs down the center. You want to make sure that you do not put this tennis ball like on the spine. There's no flexibility there. You definitely want to keep it from the tissue. So you have the trapezius muscles, you have the long muscles. You don't need to know anything. All you need to know is if you have discomfort here, I want that tennis ball to be here. And what I want you to do is, in your mind, decide, is that a 5, 6, 7, 8? And a lot of people say, well, I don't understand that. Well, if she puts this here and she goes, it's a pretty high intense pain. So 10 is just out of the mind, you can't even breathe. And sometimes people do have that. But when she puts it here, I want her to always have a number. Is that a 5? And then I want her to breathe in, hold, 1, 2, 3, and then slowly exhale. When this area here, let's say it's a 5, drops down to a 2, then I want her to move it up, either up or down, and I want her to follow it the whole way out until all the pain is reduced. And when I say pain, when we put it up here, this number here, when we laid it there under her back on the flat of the bed, it literally shot up to like an 8 or a 9. It was very hard for her to lay comfortably. But what I want you to do is, instead of going, ah, I want you to go, and allow your body to release and let go of all the tightness. How long did it take for that?
Like a minute.
It took her literally like a minute for this to reduce. And then what I told her to do is maybe do it 1, 2, 3, and then you want to go to the other side, lay here. This was really high intention for her also. But within a minute and a half, it went from like a 9 to like a 2. And then I told her to move it. We moved it down, and we worked through all that. I had her get up and walk, and then her back pain really started more around thoracic 6, 7, and 8. So we put it here, and we let her do her breathing. But literally, everywhere you have it is just a minute to a minute and a half. Give your body permission to let go of all that tightness. Go ahead and turn around. After we finished the tennis ball, how did you feel?
Oh, fabulous. It's like unbelievable.
Okay, so she's had chronic pain for a while. What I want to teach everyone here is it doesn't matter if you have chronic pain. If you want to work it out, get yourself a tennis ball. I understand sometimes the pain is so extreme, but learn to breathe it out. If you don't understand what I'm saying, feel free to call me or question me, and I will send you back a response, because if you learn the art of doing this every day, there'll be no reason why you have constant chronic back pain, okay?
Okay.
Thank you. Like and subscribe.